this is really for people who are, taking really good care of their animals and are responsible. And I know most of you guys are, because otherwise you wouldn't really be here. But I just wanted to make it clear, because videos get promoted, they get shared, and I want to make sure that this is not misunderstood. I'm not promoting wildly breeding animals, because they all need a good home and they deserve a good home. And I don't, you know, it just kills me to have to put animals down that are, not, that are really still healthy, but just because they can't find a home. So this is not what this is about. And there has been a lot of research done, retrospective research on spaying and neutering in the last few, couple decades or so. And I want to talk a little bit about that research because it's important to know some of the things and some of the diseases that are related to spaying and neutering, because we all want to prevent our animals from getting sick and having things that happen because we spayed and neutered them. And oftentimes I get people say, oh, I wish I had known, I wish it hadn't been done. And it's also about educating, because there are unfortunately still a lot of breeders out there that have their puppies spayed and neutered before they even leave their facility. And that really breaks my heart, because these animals don't ever even get to go through puberty. And they're already set up with a really poor quality of, potentially poor quality of life, because of the things that can happen, based on spaying and neutering. But basically, research has found that it shortens their lifespan. In some studies, they have found a reduction in health span by about 30%. And that's a lot, when you look at an animal that could potentially be 15 years of age or reach that, and will only live up to 10 years. So that's about 30%. So that's a huge amount, that's a lot of years that you could be missing out with your pets. Cardiac hemangiosarcoma is also 5 times more likely in spayed females and 1.6 times more likely in neutered male dogs. Bone cancers are up to 3.8 times higher. Prostate cancer is also much higher in dogs that have been neutered in male dogs. There is a thing called prostate hyperplasia, which is basically in intact male dogs where the prostate just enlarges, but it's benign. So it's not something that needs to be removed or can kill them, but it can cause issues with urination, for example, where the prostate just gets big and then pushes on the urethra, and then they can't urinate properly. And in those cases, if we neuter the animal, that, decreases and the problem is solved. But prostate cancer is much more likely in dogs that have been neutered. And, looking at the male dogs, again, there's also always the fear that, they will have more testicular cancer, and especially in dogs that have undescended testicles, where they're retained in the abdominal cavity. There's also a bit of a higher risk of tumors, but the risk is never as high as they make it out to be. Only about 13% of dogs with retained testicles will develop tumors, and these tumors are very slow growing and mostly benign, and they can easily be removed. And especially if you monitor the dog regularly with ultrasound, for example, that can really help prevent them from becoming really huge and just removing them. And then, mostly, again, they're benign. But other things that can also be affected, transitional cell carcinoma, which is a bladder cancer, is increased in neutered and spayed animals. Lymphosarcoma, hemangiosarcoma, mast cell tumors, there's also a higher risk for those. Abnormal bone growth and development, which then can cause more issues with cruciate ligament tears, because the bone plates, they close at a certain time. And when we neuter an animal, when we remove the hormones, the growth plates don't close at the right time, so the bones continue to grow. And so if we neuter them, for example, between the growth plate closing the femur, which is the thigh bone, and the tibia and the fibula, which is the lower leg bones, if we kind of neuter right in between those two closures, then one will just continue to to grow while the other already closed, which then can cause an abnormal angle within the joint of the stifle joint, the knee joint, and can make them much more prone to having cruciate ligament tears. So there are a lot of abnormalities that way. Elbow dysplasia can be another one as well. Patellar luxation, they're more prone to that, and that's especially an issue in smaller breeds. So we definitely want them to be able to grow properly. Hip dysplasia is also much more common, and other kinds of joint disorders. Obviously, urinary tract incontinence and bladder infection is also a higher risk when they're spayed and neutered, more so in the spayed animals, the females, because the urethra closure, the sphincter, is estrogen responsive. And if we remove all the estrogen from the body, then the sphincter doesn't close as well. And that can make them more prone to urinary tract infections as well, because bacteria can kind of move back in, aside from urinary incontinence. Hypothyroidism also increase. I remember I had one patient who was spayed, and then she ballooned up. I mean, when I first met her, she weighed more than double what she should weigh. So she was supposed to weigh about 25 pounds. When I met her, she weighed 60 pounds, and she was about a year and a half old. And that had, the ballooning up from the weight had actually started after she was spayed, sorry. We use spaying for females and neutering for males. So if I misspeak, just don't worry about it. Just basically removing the sex organs. So anyways, there are a lot of things that can happen within the body when we remove all the sex hormones, because they're all connected to the other hormonal glands as well, including the thyroid, including the adrenal glands, and also then the feedback to the brain and the hormonal glands within the brain, such as the pituitary and hypothalamus, will also be affected from that. And that can cause all sorts of metabolic issues, including Cushing's disease down the road, atypical Cushing's, where we have too much of the hormones being produced by the adrenal glands as a response of or as a disruption of the whole endocrine system. Hypothyroidism, I mentioned, diabetes that can't be controlled properly. So there are all kinds of different metabolic issues that can also result from that. Infectious diseases will also be more predominant because the sex hormones also have a huge influence on the immune system. And so, there's less white blood cells, etc. So they're much more prone to infections. Along the same lines, they're also much more reactive to vaccines. So they're much more likely to actually having a vaccine adverse reaction if they're spayed and neutered, up to 27 to 38%. Are the numbers that I found. Behavioral problems are also much more prevalent, such as noise phobia, fear behavior, aggression, ADD-like type of things. A lot of dogs actually, become worse because they have a decrease in hormones, and sometimes, supplementing with hormones can help with their fears. I just read a story from a dog who had low testosterone levels, and when they started supplementing with a little bit of testosterone, the dog went from being completely afraid of thunder and fireworks and all of that to basically say, yeah, well, whatever, whereas before they had tried to desensitize the dog and it didn't work. So just restoring the hormone levels really helped that dog feel much better and not have all these fears. Um, Weight gain obviously is a very common one in cats as well. I don't want to ignore those, although with cats we don't have a lot of studies, retrospective studies. It seems like they're not quite as affected by removing their hormones as dogs, for example, are. But they can also become more obese. They can have more weight gain going on as well, but they don't seem to have as much of the other things going on. So anyway, so that's a little bit of a brief intro. And I know there are a lot of questions, obviously, how do we prevent it? How do we do that?